Mr. Takayuki, if you're present, you can start us off so that we keep on moving. Meanwhile, we can try to move in front as much as possible so that the guys who arrive in maybe late, they are able to get the seats at the back. And also to have that the front seats also filled up. So feel free to move in front as much as possible. So Mr. Takayuki, you're welcome so that we can just start off the program. You're much welcome.
How can you show a presentation, please? Okay, thank you. Good afternoon, everyone. My name is Hiroki from AIC, and this is my first presentation physically after COVID-19. And still, we are fighting against COVID-19, but things are getting normal. Like today, we have 45 minutes delay as we used to. But recently, we have online and we don't have any delay. And we are Adventure Capital, which is focused on the healthcare sector in Africa. And so far, we made 26 investments. But today, I'm here on behalf of Marusho Sangyo in Japan. They were not able to come here because it takes more than 20 hours from Japan to Kenya. But I have their message here today, and I will make a presentation for them. Today it's about about infectious disease protection products. This is the next generation for the catalyst solution from Japan. Since last year, we are again fighting against COVID-19, but we hope this new technology can be helpful for you. Okay, let's start from here. And have you ever heard about photocatalyst? This is photocatalyst is a catalyst that is a substance to speed up chemical reactions. It helps to change one substance into another. Photocatalyst promotes the chemical reaction under the sunlight and LED lamps. This Japanese photocatalyst product, which is called Inval Shield M5, is made from TiO2 that is registered on FDA. Next slide, this is the mechanism of the photocatalyst. The main characteristics of photocatalyst is decomposition by powerful oxidizing action. As I mentioned, it reacts under the light. Then the photocatalyst can dispose various organic matters, which means they can decompose various viruses and bacteria as well. After decomposition, those organic matters are changed into safe substances. This innovative technology was discovered in Japan over 50 years ago. Now, let me introduce the products Inval Shield M5 developed by the manufacturer. This is a coating fluid for indoor. You can apply this to ceiling, walls, doors, windows, and any other interiors. And immediately after you apply this, it starts to decompose a virus and bacteria on the coated surfaces and change into safe substances. One of our notable experience is SARS outbreak that happened in 2002. It's more than about 20 years ago, but you might remember it. Mainly it happened in Asia. At that time, we provide this Enviroshield M5 to Taiwan and Hong Kong to help protecting against the SARS pandemic. It is used at various public facilities, also ambulances and other facilities. We have been providing this Enviroshield M5 to more than 20 countries, such as China, Hong Kong, India, and Singapore. In 2019, Enviroshield M5 was registered under UNIDO and ITPO, Investment and Technology Promotion Offices, Tokyo, as a photocatalyst coating agent that can control infectious disease, which includes COVID-19. Regarding safety of this product, we had already conducted some tests. And look at the lower right of the slide. According to this test, we confirmed that there is no toxic elution from Enviroshield M5. Okay. This is another test result about decomposition performance. As you can see, this product succeeded to decompose a gas and dirt as well. And next, this antiviral test, we also confirmed that Enviroshield M5 has high performance against several viruses and bacteria. I think you can find Legionella, Bacillus coli, influenza A, etc. And this is a field data in India. It's a bit tiny, but if you want, we can distribute this presentation after this meeting. And also we had a bacteria test after 1 year from coating application, and then still we were able to find the performance of this product. Actually, it lasts about 3 years from application. And now this is talking about the advantages of Enviroshield M5. As we saw the test result in India, this product effect is longer than other disinfectants. Generally, normal disinfectant effects last about 1 day. However, this Enviroshield M5 effects last around 3 years. That means you can keep high hygiene environment without any other treatment, also any other additional costs. Another advantage is you can see these products are without concern about outbreak of resistant bacteria. One of the main characteristics of Enviroshield M5 is a high decomposition power again. Therefore, resistant bacteria cells are decomposed by Enviroshield M5 before the cell grow. After the application, you will receive a sticker certified by UNIDO on the right side. And this year, already we have applied this product in Kenya to 2 hospitals. One is in Nairobi and another one is in Kiambu County. After the application of the product, we confirmed that the number of bacteria decreased dramatically, as you can see. On the left side, before application, the number of bacteria also was over 18,000, but after, it was only 86. The decrease ratio is 99.5%, and we believe our product helps to prevent from infectious disease in Kenya. By the way, this tester is developed by Kikkoman, the Japanese manufacturer of soy sauce. Maybe you've seen the product, soy sauce in the supermarket. And they use this machine to check their level of bacteria at the food plant. So I think you can imagine the sensitivity. And now it is used for other facilities such as health, hospital, clinics. And also, you can do this test before and after if you apply these products. And this is a final slide that shows the picture of application. Now I'd like to show the video that can explain more details how we can apply. But of course, we have contractor here in Kenya, so you don't need to do it by yourself. We can just arrange everything for you. So please, video start. And while we are waiting for the video, and today we don't have any Q&A sessions, but maybe you have question about how long does it take, and roughly you can estimate 2 days. In terms of application, we can done even 1 day or even overnight, but we need another day to dry. But after 2 days, you can start using that facility. And in terms of cost, it's a new product in Kenya, so now we are trying to identify the right price. But now we are promoting this product right now, so it would be good time to ask the manufacturer to provide a good price. Okay, it's just only 4 minutes. Thank you. we distribute this flyer on your table, and if you want to know more, you can have a look. And myself and my colleague, Faith, can stand. She's here today, so please let us know if you have any questions or you have any interest. Thank you very much.
Thank you very much for that presentation. I think we have COVID has taught us that we can do a lot of innovations in terms of infection prevention and control. So if you're interested or if you have questions about that particular presentation, I think you can see them. There's also flyers on the program, attached to the program. So I think it's one of the solutions that can really help our hospitals in terms of infection prevention. So I would like to invite the next speaker. That is Mr. Peter Otieno from AMREF. He also has a presentation on health innovations from AMREF. Karibu sana, Mr. Peter.
If you look at AMREF as an organization, we've been in existence since 1957. So we are about 64 years old right now, and we've worked across different programs within Africa. We currently have 10 country offices. We have reached a target of 150 projects who have reached 12 million people and operating on a budget of close to 100 million USD. We have three strategic pillars, quite naturally. Human resources for health. We invest in health financing using a blended financing model, and we also look at innovation. So I'd like to introduce you to the innovations that we have as an organization. If you look at AMREF Health Innovations, we have different components. Part of what we do is train healthcare professionals through our university, and this is both face-to-face and also works using blended learning approaches. So here we have both e-learning and mobile learning. We also have another platform that trains community health workers, and this platform is called LEAP, which is a platform that delivers content via 2G phones. The other projects that we have are around UHC, and here we have a project that we are partnering with Takeda Pharmaceuticals in Meru County. So the project looks at hypertension, cancer, and diabetes by connecting the demand side of healthcare to the supply side. So the community health workers go through different households, do household mapping, establish the disease burden, and then refer these particular households to the nearest health facility where they are attached. What we have seen are very good results so far in terms of outputs, because households who previously had the burden of these NCDs and were not identified are now under care and are able to be more productive in the communities that they live in. A more recent project that we are currently working on with the Social Protection Unit is funded by Bill and Melinda Gates and is in 6 counties. So what we are currently doing is an SES mapping to try and identify vulnerable households that are eligible for social health insurance. We've successfully partnered with these particular counties to be able to provide these particular households to be covered under NHIF, who previously would have been at financial risk when you look at doing out-of-pocket payments where you fall sick and you're not able to pay for your medical bills, or you need to call for what is referred to as a harambe. The other unit that we have is a clinic. The clinic has been quite successfully working under COVID by doing PCR tests for the wider general public. We are also working on more patient-centric approaches looking at healthcare, because sometimes you find that the shortcomings that we have with most of our healthcare facilities within the country is that we do not provide patient-centric approaches when we look at healthcare. Moving to the next slide, this circle simply shows you the different products and services and the fact that they do not operate as vertical pillars. They are all interconnected. So you have digital health feeding into UHC and the UHC feeding into the clinical business. So talking about the CHW training platform, one of the things that we established in the year 2014 was the burden that most governments face with training programs. As a result of this, they are highly dependent on partners. And what we did is that we proposed to them that we'd be able to deliver training via mobile learning. You can imagine the pushback, because face-to-face training in itself sometimes is not very effective. And here we are telling them that we want to use mobile learning training. So we piloted a program with close to 200 community health workers. And we would say within the first year, we had very tremendous results. So between 2014 and 2016, we multiplied the number of these community health workers by 10. But at this point, we also started realizing the value of partnering with different organizations to provide training on different thematic areas. As we speak right now, the pandemic has given us a tremendous opportunity. Moving from 2 countries last year, being Kenya and Malawi, we are now in 8 countries consisting of Rwanda, Tanzania, Uganda, Zambia, and South Africa. And we have reached a total number of 146,987 community health workers within these countries with the COVID-19 WHO approved curriculum. The next product is called Mjali, and Mjali initially started as a community-based health management information system. What we have seen is a tremendous growth with the product iterating into new features. It was used for NHIF enrollment, which NHIF halted based on some of the reforms that they are currently doing. But what used to happen is that community health workers used to go conduct the full registration process, which includes taking a photo, collecting your ID details, and getting your signature via a simple Android phone. We've also used this project partnering with different organizations such as Farm Access in a project called iPush, which looks at increasing health insurance for women in reproductive health. The SES mapping that I spoke about, NCD screening, and more interestingly, we are currently conducting a study in an urban informal settlement called Kibera on trying to establish whether hand washing sediments could potentially point to a COVID outbreak in that particular area or not. So there are very many use cases that the tool can be used for, and we continue iterating and aligning it with the Ministry of Health tools that are within the community strategy. This project is called 80-20-30, and what this project does is that we are providing entrepreneurs who are in the space of building products and services for persons living with disability with 8-module training. So we have partnered with University College London and GDI Hub to provide entrepreneurs building products and services for persons living with disability in Kenya with an accelerator program. What happens after the accelerator program is that they are awarded a particular fund to enable them take their products to scale. If you look at what has happened in the recent past, WHO has said that we are including equipment for persons living with disability in the essentials medical list. Now, this presents a unique opportunity because this project is the first of its kind actually in Africa. There's no project that deals with an accelerator program for persons living with disability. So we are looking to scale this particular project based on the lessons that we've learned within Kenya to the wider sub-Saharan Africa. So this just shows the flow of the accelerator program and the different milestones. The iPush program, which I had mentioned a short while ago, looks at different components, but essentially it's a project that is trying to conduct a study on whether women of reproductive health can be incentivized to take up health insurance. So here we have both MTIBA and NHIF being used as the social health insurance schemes, but it looks at different components such as the community aspect to create demand and sensitize people on the importance of insurance, also looking at quality improvement, and KQMH and PharmAccess have another tool that they use, and finally trying to evaluate what does this look like in terms of the outcomes related to UHC. Finally, the other project that we have is called the Makueni PPP project, and this project is based on a personal initiated investment proposal. So what we did is that we partnered with Philips, NHIF, and Makueni County. And what we were establishing is whether if we are able to invest in these 3 particular facilities, we would be able to have different outcomes in terms of health. One of the health facilities has consistently won awards based on the model that we are using here, and has the KQMH approach that it uses to constantly improve on the products and services within this facility are being used as a lesson or a toolkit to be able to expand this to the wider country. So we are currently in negotiations with Treasury under the PPP unit to see how we can model this to be emulated in the rest of the 47 counties that are outside Makueni. Maybe just move to the next slide. Again. Just move. So if you look at the structured approach that we have in place, you'll find that different entities or organizations would be at different levels of maturity. Some organizations would need to start right from the feasibility stage, but you find that some organizations may have already done some work. So this structured approach enables us to onboard different ministries of health and different partners in order to partner with them using different business models. Some can be a B2B approach, some can be a B2C approach, but what we've also found is that one size doesn't fit all, and depending on the context in which we are applying our model, there needs to be some contextualization in order to determine how we will partner. So some of the successes that we've seen so far, based on what we've done, is that we've been able to, through advocacy, convince different counties to set up bills to pay community health workers. We've also been able to do a lot of NHIF enrollment through sensitizing households on the importance of health insurance. We've been able to reach very many healthcare professionals, community health workers across the wider sub-Saharan Africa, based on the pandemic, which has limited a lot of training opportunities globally. And we keep looking for more partners within the wider sub-Saharan Africa, whether it's the Ministry of Health, whether it's corporate partners, and even regulatory bodies and development organizations, to be able to complete these 5 pillars that we are looking at. Thank you very much. Have a lovely afternoon.
Thank you very much, Peter, for the presentation. So I think he has really emphasized on the innovation activities going on at AMREF. And if you need any other extra information, I think he's also here. He can be able to expound more. So I'll still request that we move in front so that we are able to occupy the front seats. So as we proceed with the program. So we'll proceed and have another partner who has sponsored our AGM today. That is Equity Bank. So Mr. Peter Gikonyo or Elizabeth Mwiti, you can come and do your presentation. You're much welcome. Do you have Peter Gikonyo from Equity Bank? Okay, thank you.
Good afternoon, all. I have the unenviable position of having to speak to you after you have had your lunch. So I'm hoping I'll catch a bit of your attention as I do my presentation. I'll try and be a bit brief, but hopefully have a catchy presentation. As you heard, my name is Elizabeth from Equity Bank. I'm a relationship manager under corporate banking. Probably to give you a history of the, sorry. Thank you. This is us. This is our current shareholding and current status. We are listed on both the NSE and cross-listed across the Ugandan Stock Exchange and Rwandese Stock Exchange. We are a Tier 1 bank, of course, in Kenya. The biggest by asset base currently at 1 trillion. We have 14.2 million customer base across about 336 branches in 6 countries. We are owned by 30,000 shareholders across our branches. Our strategic investors, of course, are Arise Africa, British American investment company, Genesis, Equity Bank, ESOP. Again, our regional presence spread across Uganda, Kenya, Rwanda, Tanzania, South Sudan, DRC, and Ethiopia, where we have a commercial representative office. Again, that's a map of where we are represented across the region. These are our global partners, both in the banking space, our payment partners, and foundation partners. On to the health sector. This remains a key part of the Kenya Vision 2030, and is also one of the government's Big Four projects under the Big Four agenda. The sector has been experiencing major growth, as can be evidenced from the number of healthcare providers growing, the expansion of health facilities and infrastructure, emerging hospitals, nursing homes, pharmaceutical companies, and medical suppliers across the country. Our key objective of this offering that we have, specifically targeting the health sector, is to improve the quality of the healthcare across the country. We are pretty committed, as evidenced from our contribution towards the COVID-19 pandemic, to improve the healthcare of the country, to increase affordability of healthcare services in the country, to encourage adoption of sustainable healthcare services, and creation of economic value to all healthcare practitioners. Our proposed partnership number 1, Treasury Solutions. We have quite a number of solutions offered through, if you want to trade foreign currency, we even give you a Forex platform, Forex trading platform, which you can be able to trade currency from the comfort of your desks. We offer you currencies across regional currencies, Ugandan shilling, Rwandese franc, Ugandan, Tanzanian shillings. We also give you high-yielding enhancing solutions, that being investing in fixed income funds, treasury bonds, treasury bills, money market funds, wherever you feel you can be able to make some money, make some interest on any extra cash that you have. Then we also have hedging solutions against interest rate risk, forex risk, commodity price risks, interest rate swaps, of course, and forex options. Proposed partnership number 2. We do offer trade finance solutions and also supply chain, where we, of course, if you want to bring in equipment, if you want to bring in medical staff, if you want to bring in pharmaceutical products, we'll offer you facilities such as letters of credit, pre-shipment financing, bills discounting, structured trade finance. Then non-funded products would be bill levelization, guarantees if you need to give one of your partners, say a bid bond, a performance bond, so that you can be able to fulfill a certain contract, and also payment collections. Then we come to easy stock financing. We have a proposition particularly for pharmaceutical companies who have distributors and retailers under them, where we'll be able to finance owing to the strength of the distributor, or rather the anchor client. Then we'll be able to finance their retailers and their distributors to be able to supply their stock across the country. The advantage being the inventory financing solution is tailored to cater for both distributors and retailers, and the solution is geared to grow applicable company turnovers while reducing debtor book. Then we also have discounting of insurance bills applicable to hospitals, clinics, and key specialists. We're in a high-level discussion for discounting of the insurance bills with the mentioned 6 insurance companies, and still working on others that I think should be able to improve the cash flows for hospitals, clinics, and specialists, especially those who need to wait or who have been waiting for a while for insurance companies to settle their bills. Proposed partnership number 3, we have funded facilities. By funded, it means we give you money to either construct, to buy office space, to buy equipment, buy vehicles, and also import vehicles or equipment from outside. This is how it's a customized credit and financing solution where we are flexible in terms of payment, in terms of tenure. We'll be able to structure for you the deal based on what you have as security, what you can be able to give as collateral what you can be able to afford as monthly repayments. If you're able to do maybe quarterly or half-yearly repayments, we'll be able to structure the request that way. And then I mentioned on collateral, then of course for business expansion. Second, this is the construction and construction loans, office space financing. We finance hospital facilities, both construction, and also if you want to acquire probably an existing facility, we are able to support you in that through about 70% financing, giving you an extended tenure of about 15 years, which includes, especially for construction facilities, a moratorium of between 12 months and 24 months, depending on the length of construction for the building, sorry. Then we have office space financing, which we do up to 80%. I know some of you would want to buy office space across different parts of the country. We facilitate that, a maximum tenure of about 10 years. Then we move on to equipment financing. We can support your various members to be able to acquire both new and used medical equipment for the hospitals. For category 1, we have key models like Philips, Toshiba, Panasonic, National, Siemens, Mindray, and GE products that we can be able to finance. This we can do through either new equipment financing, for which we can be able to finance up to 80% and a maximum of 5 years. For used equipment, we do 70% for 4 years. We also can be able to finance other models which are not captured within the first category. Only now we'll change the financing model to 70% and 4 years for new, and used equipment 50% for 3 years. We are also able to finance motor vehicles, both for personal use and for business. We can finance ambulances, hearses, company vehicles, staff buses, which will be financed, of course, within the bank's existing asset finance policy. There's also, we can also finance you to be able to import either your vehicles or equipment, where we'll be able to give you LCs, for which once the equipment or the vehicle has reached the country, we convert it to an asset finance facility, so that now you continue on with the repayments. Now, for personal loans, we came up with a product targeting the doctors, nurses, clinical officers, pharmacists, list provided there, for personal loans, targeting the individual, where we'll give you amounts ranging from 4 million to 6.5, where we'll give you for a period of about 84 months. This you can use either, this is of course a personal loan, either buy a vehicle or buy a property or buy whatever you wish, but you need to be, of course, within the, this offering is for the specialists listed there. Yeah, but it covers a whole lot of professionals within the healthcare sector. So we also, what we finance also is the car loans, the plot purchase, construction and mortgage facilities for the individual, for the individuals, where of course mortgage will reach up to 15%, plot purchase will be 10 years. Sorry, 15 years, not 15%. Then of course we do salary advances and short-term loans. For those, for your cash management solutions, we come across payments where we are able to facilitate you to make your payments either online, or we give you checks, or you can do bank transfers. We help you collect, where we can be able to integrate the system, particularly for hospitals and any medical supplier who has regular customers who have already a specific number tied to them. We can integrate the system with the bank, so that any payments that is received is automatically updated on the system on the either hospital system or the customer system. Then we have liquidity management, where We can help you manage the shortfalls and excesses across multiple accounts and optimize the return. We can help you if you want to sweep extra funds to call or place some money temporarily in a deposit as it's waiting for other use. We can be able to facilitate that. Then information reporting, we'll share customized MIS reportings across all products. So these are our global ratings. We are rated by Moody's. We've had quite a number of awards from the banker, from Euromoney, from GCR, and several others which I was not able to capture over here. But that would generally mean that your money is safe with us, your business is safe with us. Thank you.
Thank you very much, Elizabeth, for that presentation from Equity Bank. So in case you need a product from Equity Bank, you can easily contact her. And there's somebody else needed to see Peter from AMREF. So Peter, wherever you are, you should be able to be seen maybe next to the reception or registration desk. Okay, we move on to the next presenter. And majorly, the next presenter is from KEPSA. I don't know whether Martha is here, Martha Cheruto. If she's not yet here, I think we just go on with our presentation from the sponsors. And it's an opportunity again to give our gold sponsor, that is the Africa Resource Center, and also PPB. They have a joint presentation. So I would like to welcome Anthony Okoth to be able to do a presentation. And after that, maybe we'll have Jacinta Wasike, Dr. Jacinta Wasike from PPB. Karibu sana, Anthony.
Thank you very much, namesake. For Equity, I think now I know I'll get my salary advance coming forward. On a light note, considering the fact that I've seen they've had several products that we can actually tap into. So allow me to start by recognizing the presence of the chair of KHF, the vice chair, existing board members and aspiring board members, the CEO for NHIF, and distinguished guests, all protocols observed. Good afternoon. Okay, clearly I can see you're eating, so I will not stress your life to respond to my greetings. As Africa Resource Center, again, for those who do not know me, my name is Anthony Okoth. I'm the East Africa Director for Africa Resource Center, and I'm sure most of you are asking yourselves, what's this Africa Resource Center? Africa Resource Center is a non-governmental organization which has a mandate of engaging Africa governments across Africa with the view of helping them improve their supply chain. And basically what we do is that we leverage on the private sector and academia to ensure that we are addressing some of the bottlenecks that exist within the supply chain, within the public health space. As ARC, we've been in existence from 2018 and still young as compared to most of the organizations around this table or in this room. But however, we recognize the fact that we have already had some significant traction and impact across the whole continent. We first initially started off with our product by partnering with Coca-Cola in South Africa to ensure that the same way Coke is found at an arm's length away, we were actually asking ourselves, what makes the difference? Why can't medicines be available at an arm's length away? And so as ARC, we basically have been based off 5 basic principles in the way we work. One of them is that we say that we are an independent advisor to the Ministry of Health across the region. And what we do is that we get technical expertise across the continent and we second them to the Ministry of Health to be part and parcel of the process to actually help to streamline some of the things that they have within the ministry. Another area that we work with in ARC is basically to ensure that part of the ministry leverages from the academia. So as what we do in ARC, we make sure that we are coordinating with universities across the whole continent. In Kenya, we have programs that we have tapped into the likes of Strathmore, we've tapped on into the likes of KU to actually work alongside the various different departments within the ministry to actually just help them sit down, analyze their processes, troubleshoot, and in a sense, try and come up with homegrown solutions within the local contents. In addition to that, part of our role and mandate as the Africa Resource Center is mostly to try and leverage the different donor landscape. You know, in most of the times we have a quite array of various different donors that actually exist. And so part of what we are mandated to do is actually just to bring in the various donors under one platform and enable them to engage with the Ministry of Health in a structured approach. And then lastly, one of the things that we do as the Africa Resource Center is that we work alongside or under the leadership of the ministry to actually help develop policies and guidelines such that they can actually ensure that those structures they have to create efficiencies and effectiveness across the supply chain are adhered to. And so today, as an organization, we are privileged to be having the ministry representative here because we don't speak. We actually just follow the lead of the ministry. And so we are privileged to have Dr. Jacinta here, who majority of you around this table would know as Director of Communications in the Pharmacy and Poisons Board, to come in and actually just come in and tell us more about one of the policies that actually are available in Kenya in terms of the health products and technologies, in terms of our strategic framework. And again, also enable you as a private sector know at what point they can engage through that strategy. So I'm privileged and honored to invite Dr. Jacinta to come forward and actually present. Over to you, Dr.
Thank you, Okoth. Good afternoon, everybody. I think we've had enough lunch. Those who are coming in late, enjoy your lunch. I think we had the top layer. We used to call it in high school, top layer. So you get the best when you come in early. My name is Dr. Jacinta Wasike. I'm Director of Corporate Services, not Director of Communication from Pharmacy and Poisons Board, but I'm also a Minister of Health employee. So I'm here on behalf of the Minister of Health to give you an overview of our health products and technology strategy 2020-2025 that was developed last year. It has been launched, and that it would be important for the private sector to know that such document exists and how can we now partner the ministry and the private sector to be able to implement and achieve the objective of the strategic. Am I supposed to be the one clicking? So just an introduction. The strategy and through functional supply chain system, the strategy envisions a sustainable and resilient supply chain that provides quality, affordable, and accessible essential HPTs for all Kenyans. And HPTs here will be health products and technologies, so that I do not say the whole word every time. And the strategy will cover 5 years, that is 2020-2025, and it all anchored in the key documents in the country. First of it is the Constitution of Kenya 2020 under Article 43, Section 1A, and then the Kenya Vision 2030, which aims to transform Kenya into a globally competitive and prosperous country with a high quality of life. And then, of course, the Health Act 2017, the Kenya Health Policy 2014-2030, the National Policy, Pharmaceutical Policy of Sessional Paper number 4 of 2012, and then the Kenya Health Sector Strategic Plan 2018-2023. And what was the rationale of this, developing this strategy? because we realized that previously we've developed policies and there was no implementation framework that was provided for those policies. So lack of implementation framework and strategy to actualize the objective of the national pharmaceutical policy. I don't know how many of you have interacted with this policy. It has been there since 2012. And then there's a renewed focus on HPT's agenda as evidenced by the universal health coverage and the sustainable development goals, number 3, at the global level. Also, why the significant and persistent issues in governance, management of the HPT supply chain, hindering achievement of desired levels of performance. And then there was need for HPT supply chain that fully supports the health sector, especially the ministry's health objective. Response to rallying calls from recent reviews, assessment for focused strategy on HPT supply chain. What are the reasons why this strategy had to be developed? And just to show you where it falls, that is the health policy 2014-2030. The policy orientation among the 8, the third orientation is the health products and technology. So just to show you where it comes out in the health policy of 2014-2030. And then during the situation analysis, next, there were 10 thematic areas that were picked. So the first was regulatory, policy and governance environment, product selection and quantification, procurement, warehousing and distribution, supply chain information management systems, human resource and capacity development, partnerships in HPT supply chain, quality management and rational use. Number 9 was financing, resource mobilization and pricing. Monitoring and evaluation and research. Those were during the situation analysis, that was what was done and what was found. What were the gaps during the situation analysis? So one was inadequate capacity for governance, regulation and quality assurance, inadequate transparency and accountability across the HPT supply chain, streamlining best practices to optimize product selection, quantification, procurement and distribution, gaps in numbers and skills of human resource management of managing HPTs. Optimization of HPT information management systems to improve data availability, accessibility, and utilization across the entire HPT supply chain. Opportunities for scaling up research and development and local production capacity for HPT, as well as exploitation of TRIPS agreement flexibilities. Finally, inadequate coordination of stakeholders and partners for effective resource mobilization, allocation, and monitoring and evaluation. So from there, 6 strategic pillars were developed with the outcome and key performance indicators against each strategic pillar. The first strategic pillar, which has 8 specific objectives, is enhanced capacity for governance, regulation, and quality assurance, which is very important. That's the first pillar. And the outcome of this pillar was to enable and support legislative and regulatory framework and system that assures availability and use of safe and efficacious HPT by the population. So each pillar has the outcome, key performance indicators, and the strategic objectives. I'm just giving you an overview. It's a document of 156 pages. You need, as private sector, to interrogate and see where exactly you fall and where you can collaborate. So these are just the key highlights of the document. So the second pillar was, strategic pillar number 2 is to establish and sustain a robust HPT product selection, quantification, procurement, and distribution system and use. And it has 9 strategic objectives, and the outcome is to ensure an effective, efficient system that ensures quality HPTs that are responsive to priority needs, available and accessible to the population. And this will include things like warehousing, the last miles. So you think as storage, yeah? So where do you fall as private sector in partnering with the government to actually realize this strategic plan? The third is enhance and harness collaboration and partnership at all levels
for effective coordination, resource mobilization, and implementation. And this was to ensure the outcome was collaboration and partnership in health products and technology supply chain, yielding synergies and addressing gaps to safe, efficacious, and quality essential HPTs. Pillar number 4 is about ICT. Embrace and adopt information communication technology in all aspects of supply chain for HPTs. And this was to ensure a robust information communication and technology system for HPT supply chain. Pillar number 5 is scale up capacity for research, local production, and exploitation of TRIPS flexibilities for health products and technologies. And this leads to self-sustainable as local manufacturing. We all are aware what happened to us when COVID hit the door. And we are running up and down looking for PPEs, and we're not, but then the Kenyans stepped up and said manufacturing PPEs and even exporting the same. So we need to look at opportunities on how to scale up. And now we are in serious discussion about vaccine production. So when you start vaccine production, where are those manufacturers going to get the vials for that? So there's a lot of discussions going on about local manufacturing. Even the essential product list and the essential laboratory list or the essential medical list, we have 253 product lists manufactured. So we can only meet as local producers less than 20% or slightly, they're about 20% of the essential products list we have. Yeah, so like for example, for pharmaceuticals, approximately 15 to 18%. Out of 760 essential product medicine list, we only produce 118, 120 products. So we need to step up, and actually this sector is open, wide open for the private sector to really engage and ensure sustainability within the Kenyan market, East Africa, and Africa as a whole. So I challenge you to look at this pillar very strongly. And when a pandemic happens in the next 5-10 years, we will not be running around looking for PPEs or looking for vaccine or for special therapeutics. So please take up this challenge. So pillar number 6, which is very important, we cannot implement all these pillars if we do not have the right resources in terms of HR, in terms of numbers and qualifications. So pillar number 6 is strengthen human resource management and development for HPT supply. And the outcome was to have adequate human resource for effective management of health products and technologies. So we need to train for the market. We need to see what do we need as a country, what cadres do we need, what skills do we need, competencies do we need. And the private sector can really play a big role in training, coaching, mentoring the human resource pillar. And then, of course, there was an implementation framework. It's very important. As at the beginning, I said why the pharmaceutical policy session of paper number 4 of 2012, there was no provision for implementation plan. So we didn't want to make the same mistake, and we developed a clear implementation framework that has the strategic objectives, intervention, annual targets, and cost estimates. And the implementation will entail a collaborative. That means we'll collaborate the public, the private, the NGOs, faith-based, multi-sectoral approach with participation from both public and private sector. The public sector at both national and devolved level will play a key role in stewardship, guided by the roles assigned. The national government will coordinate provision of technical assistance to the county governments, and there will be establishment and strengthening of HPT supply chain coordination units domiciled in each county health department. So for those people who will be looking for jobs in counties, there'll be coordination units in each and every county departments. And then with this also, we also provided for us risk management, because anything can happen during this implementation of the strategy. And you cannot implement a strategy without the finances. So we also we've posted the strategy, and you can see the numbers. And when you look at in the 5 years, when you look at the deficit of the plan is almost 60%. So the total resources required is 463,690 million, but the available resources are 182,409 million. So the balance or the gap is about 280 million Kenyan shillings. And we also now urge the private sector to look at where they can come and fit in and make sure that this strategy is implemented. By 2024, we'll be here now saying these are the milestones, and now we are looking at, or maybe during midterm review of the strategy, say this is the milestone, and we have even moved fast. We need to come up with new pillars to be able to move ahead faster. I think it's a very good document. I'll urge everybody in this room and anybody out there to interact with the document, so that then we know where we fall as stakeholders. I realize Kenyans, I think I've come across many Kenyans, when they see a document of 156 pages, they will rather not read. Please read the details. In every line. So please read the document, and you'll see where you'll fall as private sector and where we can actually partner and make our dreams achievable. Asanteni sana.
Thank you very much, Anthony and Dr. Wasike. I think it's one of the areas, especially on health technologies, that we should really strive as the private sector to invest in as much as possible, especially in the manufacturing of some of the reagents, the kits, and the equipments that we had issues with last year, and we showed that capability last year. I would like to recognize the presence of our chairman, Dr. Amit. Karibu sana. Dr. Elizabeth, Vice Chair. Karibu sana. And all the directors that are present. Yes. So we'll proceed and have one more presentation before we have our company secretary constitute the AGM. So we're also privileged to have Dr. Kamunyo. I think I stepped into his slot. Okay. Yes. So you can have a presentation from NHIF perspective, so that we are also able to be enlightened. Karibu sana, Dr. Kamunyo.
Thank you very much. Chairman, Dr. Amit, Vice Chair, Dr. Wala, ladies and gentlemen, I would also say colleagues, good afternoon. You know, six years ago, I was in a position many of the folks here are. That's when we were campaigning to to become directors of KHF. And it gives me great pleasure to be here today. 6 years later, actually now it is 1 year since I stepped down as director of KHF. So that means it's 1 year since I became the CEO of NHIF. And just to share a few words, my entire life having been in private sector and then diving into NHIF, which is public sector, there was one thing that stood out for me the minute I stepped in, and that was the scale at NHIF. And not just the scale, and also the impact that it actually has on the healthcare ecosystem in this country from that lens. And I would just like to share with you just a few highlights. This year actually marks 55 years since NHIF came into being, after it was set up as a department in Ministry of Health and eventually became a parastatal in 1998 upon the enactment of the Act then. And as you're all aware, we are on the journey of scaling up towards achieving universal health coverage, and NHIF is a vehicle. We've always been talking about this platitude of, UHC is not an event, it's a journey. And indeed, that journey, NHIF has been driving it since 1966, when we were set up to provide coverage for civil servants and eventually opened up to voluntary contributors in 1972. But what is interesting is that we actually did have a state of UHC pre-independence. For those of you who remember the heart tax, when we had the heart tax that every household had to pay, and they had access to free healthcare then, and it was available. But as healthcare continues to evolve, both in complexity and also in cost, it needed that we relook at how we approach healthcare financing. And NHIF having that mandate, whereby until 2015, it was a very basic reimbursement model of bed days. And then after 2015, we evolved to having outpatient covers, as well as packages to address the needs of our Kenyans. Now, this journey cannot happen from the perspective of public sector alone. The private sector plays a key role and will continue to play that key role. I'm sure you're familiar with the statistics that we have, because as an insurer, we give a promise to the contributors that when you give us the 6,000 per year for your family, which is equivalent to about 17 shillings a day, or whatever contribution from formal sector, so that's the statutory contributions, depending on your salary up to 1,700, that will give you a certain set of benefits. Those benefits are provided by most of you as our providers, as well as the providers in public sector. Currently having over 8,000 providers, it is interesting that only 26% of those 8,000 are private sector. However, about 70% of our reimbursement actually goes to private sector. And it begs the question, why does that happen? You should follow, arithmetically. But we've done some studies, and actually we did some also research in the last couple of months. And it's a very simple answer. And the answer is the services that are provided also in private sector are more consistent. So the patients, our members, tend to choose the facilities. private facilities as point of call for their healthcare. So that tells us that in our journey towards UHC, we must work together. Now, right now, we're also in the middle of reforms at NHIF to be able to handle and to be able to be as a strategic purchaser for healthcare services and to be able to efficiently provide that promise to the people of Kenya as we seek to achieve universal health coverage. And to get to this, there are one or two silver bullets. And number one is that our contributors, all those who can contribute, do contribute. And those who cannot afford to are identified and supported to do that. And this is because the model that we're using towards achievement of UHC by next year is an output financing model, based insurance model. And to get us to that journey, the government has also come out the front by supporting in phase 1 20% of the 5.1 million indigents who have been identified in this country. And I'm actually happy to say that we actually got to 999,990 this morning. And these were numbers that were given from the counties, and we've been in the process of registering them. Now, it is key that we continue to support the other 4.1 million indigents who cannot afford to have access. And this is where we'll also call upon the private sector to support this. And we are looking at models like adopting families, adopting villages, adopting slums, etc., to be able to support that. Because the government has committed to ensure that every Kenyan has access to the healthcare that they need without financial hardship. Now, there are issues that have risen, and if you also recall in 2018 about, the sustainability of NHIF, and I'll also share with you another silver bullet towards that. And that is the voluntary contributors that we have. And this is where we have a challenge, that most of them are not consistent in their payment. They default shortly after accessing services. So this adverse selection is what is creating a heavy strain on the fund. And that is why you see also in the amendment bill that it's been proposed that all Kenyans who can afford do pay for their premiums, because it has been a trend that has been there. And as at end of last month, on our database, we had 10.64 million registered members, but we barely had 5.3 million who were active. But the rest who were not active had enjoyed benefits. And you can imagine, with the benefits that we have enhanced over the last couple of years, a family paying 6,000 and enjoying 500,000 shilling benefit, or those who are on dialysis, if you calculate how much they get, it's about 940,000 shillings annually. You realize that with such a trend, then the fund would struggle. So we seek your support to ensure that every Kenyan can have access to the quality healthcare that you provide, that the public facilities provide, without that financial hardship. So we are indeed looking forward to working together to ensure that we actually get to achieve one of the big 4 pillars of His Excellency the President, which is universal health coverage by next year. I strongly believe that by the end of this year, with the reforms that we have been going through, we can be able to achieve. With the support that you would be able to provide us, we can be able to achieve. And once we have every Kenyan on board, I believe that our health will in general improve and that there'll be a peace for everybody to be able to thrive. So once again, Chairman, it gives me great pleasure to be here, and I'm looking forward to the results of the elections as we foster more partnership. I can also mention that in the last 1 year, we've had quite a bit of engagements, starting from the Ministerial Stakeholders Forum, and also engagements between NHIF and some of the groups, especially the provider groups, to ensure that our relationship is seamless and we are able to work together towards the common goal of ensuring that every Kenyan has access. So ladies and gentlemen, thank you very much for your attention and time and inviting me.
Stand right there. You gave 5 years of your time to Kenya Healthcare Federation, and we appreciate that very much. We called you on short notice. We didn't give you any official invitation, and you've given a wonderful, wonderful overview of, I think, what would not have had without you. So we appreciate that very much. I would like to call our chair, Dr. Amit Thaka, and because I know you have to leave, we have to do the honorable thing to those directors who have served us. We have paid them nothing, but they have given all their time and expertise to Kenya Healthcare Federation. It is the reason that we are, and we're happy, and that at NHIF you're also able to engage us. We can call you up. I'm sure there's a lot of opportunities for engagement, and I know you're doing your best, but we shall continue, and we promise to continue to engage you at even a higher level. So, asante sana.
Thank you.
Bwana Chair, Claire, please. So what we have for you is a gift of appreciation and a shield, just to confirm that you did serve Kenya Healthcare Federation, but we can't give you anything more than that for compliance reason, and also, you know, this is the best we can do.
So the plaque reads, Peter Kamunyo, Dr. Peter Kamunyo, Board Director 2018-2020. It's a pleasure to hand over this plaque for the selfless service that Peter gave KHF. Thank you, Peter.
Thank you very much.
Maybe, is that, maybe...
Thank you so much.
Thank you, Dr. Kamunyo. Thank you, Dr. Amit. We appreciate that very much. I want to hand it over back to my the main facilitator of the day, Dr. Jakodo. For those who don't know me, my name is Dr. Anastasia Nyalita. I'm the KHF CEO, and we are now moving into the main agenda. So, Jakodo, if you may. Thank you.
Thank you very much. I think Dr. Kamunyo has the privilege to get the present earlier, top layer. Asante sana. So I also like to recognize another board member, Joyce. Karibu sana for the session. So we move on to the next agenda, which is the constitution of the AGM today. And I would like to call upon Ms. Anne Mululu, our company secretary, to constitute the annual general meeting and also to confirm the previous minutes. Karibu sana, Anne.
Good afternoon, everyone. I'm not Anne Mululu, I'm sure you're waiting for her. I'm stepping in for Anne Mululu, the company secretary. So as per the notice dated 5th of May 2021, this is the annual general meeting of the Kenya Healthcare Federation. I would like to confirm that the quorum has been met and we can duly start the meeting now. I'd like to confirm the minutes for the last meeting. So I'd like one person from the organization to propose and one to confirm. A proposer, please. You can propose. Okay. Any seconder? Any seconder on the confirmation of the minutes for the last AGM? You second. Thank you very much. Thank you. The second thing on the agenda is to confirm is the chairman's report. Okay. Okay. The auditor's report, the next thing will be on the auditor's report for the year ended 2020. Okay.
Good afternoon, members. Good afternoon. My name is CPA Ronald. Bossy, I'm going to present to you the auditor's opinion on behalf of Evelyn Kanjago. Evelyn Kanjago was the manager in charge. I was the engagement partner. I'm the group managing partner of Ronald's LLP. It's an audit, tax, and advisory firm based here in Westlands. So ordinarily, regarding the auditor's function at annual general meeting is to read the opinion, because normally the primary responsibility of an auditor is to review the financial statements in terms of their completeness and also
whether there is sufficient corroborating documents to support the opinion. So I will go directly to the opinion, but the financial statements, the accounts are prepared by the management, of which we audit and issue an opinion. So I don't know if you can scroll directly to the auditor's opinion. Oh, I need to do that using this one. That's auditor's opinion. So the opinion reads that we have audited the accompanying financial statements of Kenya Healthcare Federation, set out on pages 7 to 17, and they comprise the statement of financial position for the year ended 31st December 2020, the statement of comprehensive income, statement of changes in fund balances and cash flows for that year, and a summary of significant accounting policies and other explanatory notes to the accounts. In our opinion, the financial statements give a true and fair view of the state of the Federation's financial affairs for the year 31st December 2020, the results of its operations and cash flows for the year then ended in accordance to the applicable international financial reporting standards and the general accounting principles. The audit is conducted based on the international auditing standards, standards of auditing, and then our responsibility is it's under those standards is also described in the report. As auditors, we are independent of the federations federation in accordance with the International Ethics Standards Board. There were no key audit matters. Normally, if there are matters that are key or critical in the auditor's work, we consider those matters and have an obligation to communicate them to the members in this report. But in this year, there were no critical key audit matters that we feel, in our opinion, that we need to communicate. Maybe just briefly is to refer you to the statements that we audited, and I will summarize the statement of income and the statement of the financial position. Okay. So under the statement of comprehensive income, we have the subscriptions, the increase from 5.7 million in 2019 to 6,684,234 this year. Then we have some project income by various partners as described there. So we have almost 25 million shillings, 682,674 various partners' contributions to various initiatives by the association. And then there is also accompanying expenditure summarized there, and a surplus from projects, which is 2,552,105. Then ordinary expenditure for the association of 5,985,000, giving us a surplus of 699,145. There's a small deferred taxation of 4,000, giving us a surplus of 703,917. Then the balance sheet for the association, that is on page 8, which I believe this signed copy has already been shared with all members of the Kenya Health Association Federation. So in the balance sheet, we have small non-current assets of 247,000. And then now we have assets, mostly is cash, 11,884,278 in the bank. And then receivables of 239,000, which total assets is 124, then the fund balance of 2.3 million, then accounts and other payables 10 million shillings. So most of the cash held is attributed to various payables and also partner balances that needs to be actually utilized in the subsequent year. There's a small reserve of 2 million shillings, which can be improved in the subsequent period. As it is now, the balance sheet is okay. It's not an insolvent organization, so we can merely just improve on the reserves. So page 9 is the fund balances, which we've said is 2.3 million, and I would not want to go into detail of that. And the cash flow is also a reconciliation of the items of cash, especially from operating and investment activities for the Federation, giving us a net effect of 11 million shillings, 884,278 in cash. The other pages are policies which have been adopted by Kenya Healthcare Federation, accounting policies and notes, and then there are also supporting notes and breakdowns on the financial statement. So thank you so much. We really appreciate for the opportunity to have acted as the external auditors for that period and given an opinion, and we look forward for continued engagement. I think I want to give it back to the chair to proceed, unless there's a question. No question. Thank you.
Thank you very much for outlining for us the financial audited report. At this point, I'll ask you to entertain if there are any questions, comments from the members in regards to the financials of the year 2020. If there are any questions, comments, just raise your hand and we'll bring the mic to you. I guess there are no questions or comments. Okay, if that's the case, then I'll ask Ronald do you have any other final comments before we ask you to leave and discuss the appointment of the next auditors? All right. Okay, thank you very much. And let's give them a round of applause. Okay. So for the audited report that has just been presented, for the audited report that has just been presented, so Ronald's LLP did quite a good job, and this was the second year that they have audited our financials as KHF. So on behalf of the Board of Directors and the Treasurer, we wanted to propose to you as members that we retain them for a third term, which is next year, this financial year, as our external auditors, and bring it to you as members to deliberate and give your go-ahead. So if I do have a proposer, a seconder, or any objections, I think this is your time to give your say. So we have a proposal to have Ronald's LLP run as our external editors. Do I get a seconder? Thank you, Anthony. Going forward, then we will retain Ronald's LLP as our external auditors for this financial year. Thank you. I think so. We can move on to the next, the first agenda item, which I think was the chairman's opening remarks.
Please do.
Okay. So sorry, I moved too fast. We needed to have a proposer and a seconder of the financials of the 2020 audited accounts. So do we have a proposer? So we have Muna. I think that's Muna. Proposer. Thank you. Do we have a seconder? So we have Dr. Muruti as a seconder. Thank you.
Yeah, well done, Walter, on that financials. It's always important. Good afternoon. It's really an honor and a privilege to be addressing members, partners, friends of KHF at this last AGM that I'll be the chair. Truly, I'm humbled. And it's really nice to see so many of our members come to this 13th AGM, which follows what we had in the morning at KEPSA as the 17th AGM. We started almost at the same time, but some of you will remember the security came to check us when we were registering KHF, and they questioned us. It took us 4 years before we actually got the registration certificate, and since then, it's been nothing but growth. So honestly, I'm really humbled, and I'm really excited to be addressing this august gathering and esteemed members at this AGM. There's a lot to be proud of, and there are so many people I want to thank. It started here, as you see, in about 6 years ago in 2015, when Walter Okok, who was my predecessor, finished his term, and I took over at an election that took place at the Kenya Private Sector Alliance. I want to thank a lot of people. In my term, in my journey as KHF, it's impossible to name everyone. But let me start with my gorgeous wife, Sabira. My daughter, Alisa, and my daughter who's not able to join us, my older daughter, Serish, who's in the US. Alisa came back just a few weeks ago from Vancouver. But from the pictures you can see, I have actually grayed a lot in the 6 years, and my wife hasn't even aged one day more from the time I took over office at KHF. So something that she has done is to keep the space for me to do this voluntary work very well. And you all know how household support is. So I really want to thank you, Seb, for all the support you've given me during my journey on doing this work at KHF. Looking back on how KHF started, we've come a long way in these 17 years. Some of you remember, just earlier, Dr. Kamunyo spoke about NHIF reforms. It's an engagement that we've been having since 2004. There was a bill in Parliament. Gakombe, we worked in the trenches. Walter, you remember that, and many of the people here, you remember the NSHIF Bill 2004, which was a noble idea, but was going to increase the cost of doing business. And we were working as institutions together, and we realized we didn't have a voice of the private health sector. That gave rise to 7 members coming together, moving from office to office and trying to create a position paper. And when we presented it, we were asked, who are you and who do you speak for? That's when we realized that an apex body, which is the voice of the private health sector, was missing. It just happened that Professor Nyang' Nyong'o and Mukisa Kitui were championing during the Mwai Kibaki's regime on setting up KEPSA, which was going to be considered as the voice of the private sector, as the engine of growth to create jobs. We were riding on that, took us a few years. That bill in Parliament, NSHIF 2004, was really going to make the cost of business extremely high, because it at one point proposed 6% of payroll being contributed to as premiums by employee and another 6% by employer. We decided that something had to be done. The 7 founding members at that time came together and started proposing changes to the bill. And that went on. Eventually, it reached Parliament, and in Parliament it goes through readings. It went to the 3rd reading, and we thought it was going to be defeated, and the private sector was so strongly opposing or proposing a change. It actually passed the 3rd reading. And you remember it happened at 7:45 p.m. in Parliament. And that's the time we thought, this is going to be a disaster. It only needed President Mwai Kibaki's signature. He had to assent the bill for it to become law. And lo and behold, he said, this is not going to receive my signature. That began the journey of how private sector will influence policy for the good of the country. We adjusted that, and you heard earlier, now it's part of universal health coverage. We are happier, much happier. Many of you here started business after 2004. Many of you also see that your bills are now being paid by private insurance, NHIF, in a different way. And many of you understand that your payroll is sustainable, notwithstanding the unprecedented times of the COVID pandemic. UHC is now part of the Big Four agenda being led by Uhuru Kenyatta's administration. This success in the formative stages of KHF gave us the launching pad we needed. We started with just 7 founding members, and our current membership, through the efforts of all of us, now stands almost at 200 institutions. Each one of these members believes in the cause of influencing policy, creating a more enabling environment, promoting affordable, accessible, quality health services across the entire country. Since the beginning of my term in 2015, and Leah will probably play a few pictorials that you can see as I speak, we have been increasing our membership growth at an average rate of 20% per annum, year on year. We have seen our membership funds grow, as you've seen in the audited accounts, from 1,800,000 to 1 million to right now over 7.4 million shillings annually from membership contributions, thanks to all of you. We have seen our advocacy work grow, and our annual revenue since 2015 has multiplied 7-fold, thanks to these champions and the board that we have working so hard. This means we're doing something right. This means we have space. In addition to membership, partners continue to engage KHF to carry out projects that improve the overall health for communities within counties, reaching the grassroots. One of the projects I want to highlight is Funzo Kenya. And within that, there was the Afya Elimu Fund. In partnership with IntraHealth, we actually had 2 of our staff working there from KHF. Emily Muigai, I hope she's here. Joel Momley, she's here, if you can just raise your hand. And they represented us at this project, which was started to promote a loan system for health workers. This inspired young people, most of them were from hard-to-reach areas, to become health workers and go back to serve their own communities. As at December 2020, 31st, Afya Elimu Fund had supported 35,895 students to the tune of funding of $25.8 million US, with major contributions coming from HELB and USAID. KHF expanded this and brought in the likes of Standard Chartered Bank, I&M Bank, Family Group Foundation, and Rattansi Education Trust, just to name a few, to ensure that an additional 11,000 students become beneficiaries of this program. Thank you so much to all of you who contributed to this. Another project I want to highlight is with the German Maltesers International, known as the Multi-Stakeholder Partnership, where again, you remember, we had many people from the counties who kept coming to Nairobi, and we started going to different counties. And the main idea there was to address auxiliary health workers who remain forgotten. When we voted for these cadres, we came out with the top 3 that needed support immediately, and KHF took it upon itself to incubate them and harness the strength of these cadres. They include community health workers, emergency medical technicians, and health records officer, who for a long time were not recognized. In these areas of policy and advocacy, and you can see how we have been engaging regularly with ministries of health, county governments, and the region. We've engaged with 4 ministers of health since the inception of this new board, which was started in 2015. We institutionalized the Ministerial Stakeholder Forum model, which enables us to follow through the agenda items that are of key importance to the private sector. The quarterly Ministerial Stakeholder Forum remains the engagement organ that drives appropriate changes and allows us to influence and constructively engage Ministry of Health. Through these mechanisms, we have effectively been able to reduce costs of healthcare. And let me give you 1 or 2 examples. You remember the VAT, which is often known as the very annoying tax. And this very annoying tax in our sector is a major concern, because none of us actually charge VAT to our patients. So our cost of VAT is borne by the sector fully. So somebody pays for the VAT in health, and that happens to be the patient. Every patient that seeks treatment is absorbing VAT, because I'm sure all of us incorporate our VAT costs into our services, and we are not claiming it. One sector that really got affected in large volumes to the tune of almost 65 million every month was the pharmaceutical sector. So we removed the VAT on raw materials that was largely coming in from China and India to reduce the cost of local production and make them more competitive. The other important success we had was the World Bank project, when they brought us on board to harmonize regulatory boards in order for them to work effectively. Many of you who run clinics and hospitals, you know what used to happen when a regulatory board used to visit you. They would come with media and police, and they would find an expired drug or a lab reagent or they don't find, what was it called, placenta pit, and they would like to shut your facility down, take photographs, and probably take you to jail. We found that extremely annoying to the private sector and retrogressive. It took us a long time to engage the boards and make them understand that they are not fee-seeking organs, but they are service organs. And to enable us move to the next level, we talked about a joint inspection unit. And since then, we not only have managed to have them come together, but look at how to raise our standards, but they gave us 2 seats on the joint inspection team that we as private sector can go around and help our fellow members raise up their standards. So I think that is a great achievement that I did want to highlight. We did not limit our involvement at the national borders, but we've been a true leader in the region and on the continent. After the KHF concept and governance, we went to Uganda and showed how we were working. And many of them have now tuned in to the live stream. And my greetings to the members from Ghana, Uganda, Tanzania, South Africa, at least 4 countries that I know who have logged in to this stream. They took our concept and replicated it. And we then in 2012 institutionalized the East Africa Healthcare Federation. We now have 27 countries on Africa that use a similar model. The largest federation, which is inclusive, is Kenya Healthcare Federation. Well done, members, on the continent. We are truly the largest. There are some associations that are larger than us, if you see their accounts and you see their funding. One large association is the Board of Healthcare Funders in South Africa. That includes Discovery, Momentum, Outsurance, but they only have membership of insurance companies. We also have a very good association in Tanzania of private hospitals, known as AFTA, but they only bring the hospitals. As far as the federation is concerned, where we are inclusive of all subsectors in healthcare, Kenya Healthcare Federation stands as a giant amongst all the rest of Africa. So well done, members. We've done really well. This gave us a solid foundation. And this is what was required when we were dealing with the pandemic last year. What a year it's been. March 13th, you all remember what happened, even when the president interviewed the 2 people who were the first COVID patients. Wala, do you remember her name? I forget her name, but it was and he invited them to State House. And then after that, there was a lot of media that did they really get COVID or not? But the fact was, we found who was the first patient, and we went to Kenyatta National Hospital and started discussing preparedness with Dr. Mercy Mwangangi, and we saw the first isolation facility in KNH that was designed to handle Ebola. And it was within 21 days that Bagathi was supposed to prepare a facility that will manage isolation. We, as members, quickly got together, and through the efforts of our CEO, Anastasia and Leah, we instituted the COVID-19 response team, KHF. That swift action enabled all of us to understand how we were going to deal with COVID, including getting passes for the staff, passes for your vehicles, and engaging the government relentlessly on a 7-day-a-week basis to make sure that we don't get to the 100,000 mark by July that Africa CDC was projecting in 3 months. It was a scare. We did it. We understood the value of masks, social distancing, sanitizing, and we had all our private sectors contributing to the protection of our citizens. We made ethanol, donated it to the government. We made PPEs, manufacturing, almost 100,000 meters were being produced at that time per day, and now we are producing over 1 million meters of PPP a day when we have repositioned our manufacturing companies. We donated mattresses, we donated buses, we donated lab stations, and the most important is we started positioning ourselves for testing. There were only 2 countries that could test for PCR for COVID. Do you remember where our first tests went? We were shipping them to South Africa. And we used to wait for a week and sometimes even 2 weeks before we got the results. Our first consignments went there. Many of you I can see here as members. I want to single out all the lab providers. I know many of you brought the viral transport media. You also brought in the tubes, Science Scope, FNS Scientific, Chemoquip, just to name a few people. We were able to start looking at testing locally. We opened up testing so that the private sector labs like Lancet, Pathcare, Meditest, and the hospitals, and AMREF, and many others started doing tests. We're proud to say that today, close to 40% of the tests being done for COVID are being done by us through the private sector. So well done. COVID also taught us that public-private partnership was important. It was critical for us to reposition our hospitals and clinics and start admitting patients so that we can look after them well. We also had to deal with NHIF for bed debts. It's much better than what it was last year. We also had to deal with how do we charge patients for N95 masks. We never had them on our bills. You never went to a hospital bill for appendectomy and saw N95 as a charge, or you saw 8,000 shillings per PPE per day for staff. And if you're staying there for 10 days, you can imagine how the cost of healthcare went up to the patient so that they had to cater for these bills. We realized very quickly that our design of the hospitals need to change. We included Architectural Association of Kenya, and hospitals will never be built in the same way ever again. Entry and exit must be accounted for when we build hospitals. Infection prevention control will be a mainstay of architectural design so that you reduce any spread of infections through this pandemic or others. Our hospitals clearly did a marvelous job in ensuring the health workers were protected. We fought for their rights. We were very in the forefront when it came to making sure they got the PPEs, and many of you came forward and donated PPEs. Stanbic Bank, I'd like to really give them a big round of applause as a bank who did something truly amazing and have been able to send PPEs to many of the private sector facilities. So we've done a lot, and you can imagine all this through the COVID-19 response team, working with the Ministry of Health. The kind of partnership we had only was possible because of the foundation we had laid for the past 15 years. Let me just talk a little bit about COVID before I end my address, because vaccines. Let me speak about vaccines because I know it's top of the mind. And we all know that the private sector attempt to bring vaccines was banned suddenly on 2nd April. And the 75,000 doses of Sputnik that one of our members here, Harley's, was forefronting, was asked that you cannot sell any more vaccines. We were all disturbed. Many people still remain disturbed, but there was a clear procedure of the why. KHF supported this. KHF understood the reasoning why, but at the same time, we wanted to open up a window of private sector participation through other means. The reason it was banned was that retail sales of vaccines is going to disrupt the market. It's pretty clear. It's going to disrupt equity. 8,000 shillings a vaccine that means the people who can't afford a vaccine will not get it. None of us in KHF want to see that inequity. 8,000 shillings or 5,000 shillings a dose means people who are unscrupulous will start selling vaccines that may not even have the active ingredient. None of us want to see that happening. The cost of policing this nonsense on the continent or the country would be far more expensive than we need. We've now decided we will move and open up a window of an aggregation system. The MOU between private sector and Ministry of Health has already been signed, and I'd like to thank Dr. Akwale and CS Mutahi Kagwe for all those efforts that they've. This MOU clearly spells out that an aggregated model will bring the private sector contributions through the KEPSA collection system, where we will piggyback onto the procurement process that the government is seeking to get more vaccines. This will allow that we get the right quality and we probably get the right price, but the importer shall remain the government. The government then will allocate to the private sector its fair share or its paid share of the vaccines for use at specific areas that will be pre-registered. So it will be pre-bought, pre-allocated, and the shipment will be managed. It gives us a window. You all have a survey, and I'm sure that the Secretariat has sent this across. Fill the survey form. Let us know how many staff you would like to purchase vaccines for, how many families you would like to purchase the vaccines for, and how many community members would you be willing to support. With that aggregation, we should move our level from 30% to 40% and maybe even 50% as we move and work towards herd immunity. I extend my appreciation to the private sector and the team that's worked tirelessly on the process with KEPSA leadership on making this window of MOU happen. I'm confident that this MOU will open up supply channels and hopefully we'll see more vaccines come into our country. I want to thank many individuals who have played leadership roles at KHF over the past few years. I also want to thank the strong board that has enabled us achieve all this that I spoke about. And let me tell you something special about our KHF board. 50% of our board are women. So we do have, I can tell you one thing, without women, you wouldn't have so much power. And I want to personally thank all the board members and the men on the board, Anthony, Walter, Steve, Peter. I think you should give them a double round of applause for what you've seen them do. Thank you, ladies. The 6 strong committees at KHF, led by many of you here as chairs, through wide participation, has enabled us have evidence-based policies, which has shaped the health ecosystem in the country. I urge all of you to continue giving this support to these committees. So much of what we have achieved would not have been possible without the vibrant involvement of many board members that I worked with throughout these years. I also want to extend my special gratitude to 2 people, and Alisa, if you can help me with the bouquets and ask them to come. And there are 2 people especially I want to extend because I know how much they work. I know they spend sleepless nights and work on odd hours with me. Please join me in welcoming our administrator, Leah Odundo, on stage. Leah, most of you know Leah. She may be sitting, even now you can see she was making sure everything's working well. But Leah is one such person who, when she is fully involved and dedicated, she manages to pull out what KHF can do. Leah, our special thanks to you. Thank you, Leah. Leah, keep up the good work. I love your commitment And I love your growth. And if you see where Leah started and what she does today for KHF, I'm extremely proud about her achievement. I also want to call on stage a champion who's been leading from the front and represents many of us at the board, many of us who are not able to make it at high-level meetings, and now has taken over management to such an extent that I sometimes ask her, do we have new staff? What are they doing? And these are all things that used to really take up my time. It used to take up my time, maybe contracting staff or following them up and making sure that I don't even need to see what's been happening. If I know there's an event, I can trust that leadership in her will make everything happen. Anastasia and Alita, you've done so well. And I think if there's someone who's really happy, then I'm sure my wife is happy that you are here. Anna, good job, and honestly, keep up the great work. You have a long journey ahead, Anastasia, and I think the foundation has been set, and management of KHF will actually drive the progress. I want to thank Dr. Cleopa Mailu, the first CS that we engaged with, and we started working with him. I want to also thank Dr. Walter Okok, who served during his term and now is a KEPSA trustee. I also want to thank Mr. James Masharia during his tenure. I think some very interesting MES structures took place. I want to thank Ms. Cicely Kariuki. She was a tough one, and we had some tough MSFs, and she really, you remember those MSFs, and she would put her foot down on many aspects, and she would tell me clearly that these are things that she will not support, and profiteering is not something that she wants. But she was tough, and we learnt a lot, and she actually graced our 2019 EHF conference and challenged us quite a bit. And finally, I want to thank CS Mutahi Kagwe. If you have heard this saying, baptism by fire, and he's definitely one who understands what that means. It was the first address he made. It wasn't like, he mentioned the words, and I'll remember, it wasn't if we are going to get COVID in Kenya. It was when we are going to get it. And that was, I think, February, and he just came into office. And I also want to take this opportunity to thank all the board members, who have served with me in these 2 terms. They've done a marvelous job. The incoming chair for the Kenya Healthcare Federation, Dr. Kanyenje Gokombe, who is here, who served as the vice chair during our first term. We had a very amazing time when we were setting up structures at KHF. But most of all, I know Gakombe because we studied together at the University of Nairobi. And I think, Sab, you remember, we were all, unimates at that time. And Gakombe and I have known each other since the days of University of Nairobi. We started our career in private sector almost at the same time. And the investor in our hospitals, coincidentally, is the same. And they have managed to turn around what you call the financial model. I am confident that his leadership, together with the new directors, will take KHF to the next level. Today is a day both to look back and look forward. I'm grateful for the opportunity to celebrate on what we've accomplished in these few years. But I also want to look forward to remember that although we've accomplished much, there is so far to go. Kenya needs a more well-functioning and a stronger health system where private sector will remain at the center place. It is our job as a federation to ensure that as members and partners, we continue to build this step by step, year by year. We can do this, and I know together we will be stronger. Thank you so much. Anthony.
Thank you very much, Chair. What a colorful speech and a colorful journey. I think Dr. Meet has served the Federation quite well, and the milestones that we've achieved as a Federation has been courtesy of his energy that is always non-stop. So thank you very much, Chair. I think I also like to thank him for hosting some function just to usher me to the board. Yes, I think we had a wonderful meal, courtesy of some. So I really thank you. Yes. So having heard from our chair, I would like to invite Dr. Wala to just come and give us some beautiful stories about the exiting board members, and also just to allow them to just say something. Some are following us virtually, and others are physically here. Thank you very much, Dr. Wala.
Thank you very much. Good afternoon. I think it was so nostalgic going through the photos, Amit, and you are synonymous with KHF. So a part of you stays with us, and we are still in touch, so we want to wish you a good transition from the bottom of our hearts. And for Sam and your daughter, thank you. Thank you for opening your house to us. We've had a couple of drinks and meals, as has been mentioned, and I've asked for the last one, for the new board that's coming in and the one that's going out. So thank you. Yes. So as we were going through the photos, I was, of course, picking myself out, and I noticed my hair was changing, my dress was changing, but my shoes are still the same, the red ones. So perhaps I need to change that. But change is inevitable, and change is a factor of growth. So we want to appreciate, this is a momentous time for us. As part of the board, on behalf of the ones who are staying, I want to appreciate 3 board members who are stepping down because their term is over. I will not include Dr. Amit because I think that's a special occasion that's going to happen after this. So I want to mention Joyce Wanderi, if you're able to come. In absentia is Faith Muigai, who's out of the country at the moment, and Dr. Jacqueline Kitulu, who has also traveled. We had a speech by Faith that I'll read, but I'll allow Joyce to just give a few words. Thank you.
Thanks, Liz. And it's so great to see so many members today. Even if nowadays people don't go for meetings, it's just nice to see how many people sacrifice their time to come to this place. So thank you very much. I am really honored to be stepping down from this board. It's been a wonderful 6 years journey, serving alongside Amit and the rest of the board members. We truly became a family, I must say, and I hope that the new board will actually take after us. And had some good moments as well, not just all work, but we also had some play moments that were really good. We all understood each other's diversity and what we bring to the table, and had a very harmonious relationship as a board, understanding very well what each of us and what our strengths are and what we bring to the table. So it's really been a wonderful 6 years. And this morning I kept wondering, oh my goodness, what am I gonna say? But I think Amit already said it all. For me, it's just 3 reflections of what has really been a big growth for KHF, and you mentioned them very well in the report, around membership that is tremendous, issues around the advocacy agenda, and being the true voice of the private sector has been very clear for KHF. And one other thing that's been also very clear is just the engagement with government and the Ministry of Health and other government bodies. I think that have made a big difference. And despite, of course, feeling like some things are not moving as fast as we want, I think the door was open, engagements were going on, which is great progress. So for the rest of the team that's joining the other members, I really wish them the very best. I think this is a testament of real good governance. We've served our 6 years, we don't want to stick on the chairs. That's what good governance is all about, that was set up for KHF. And
every team brings in something new, and every new leadership brings something new. So as much as KHF is synonymous with Amit, which we all know, I believe also Dr. Kakombe will be able to bring in something new and take KHF to the next level. So it's really nice to see that we are closing on a very high note, or rather we are exiting on a very high note. But for me is to wish you the very, very best from the bottom of my heart. We are going to, of course, continue to be members. I am a corporate member just by my organization. But I do hope we'll also send Amit an invoice for 2022 so that he can remain as a member, because now we are shifting to, yes, we are shifting to support KHF as members, and we'll always be there as a KHF family. So thank you very much for giving me the opportunity to serve, and I'm really proud to be part of KHF. Thank you. Thank you so much, Joyce. I have a speech on behalf of Faith Muigai. I hope I'll give it the energy that Faith usually brought on the board to it. But she wrote this: to our chair and vice chair, board directors, the CEO, Kenya Healthcare Federation members. It is with great humility and sincere pride to have served for 2 terms as a board director for the Kenya Healthcare Federation. Under the guidance of a dedicated and strategic leader, our chair, Dr. Amit Thaka, significant strides have been taken to strengthen the position of the private sector and provide an enabling environment to eliminate sector contributions in our national and global health ecosystem. Significant barriers have been overcome with proactive dialogue, partnerships, and collaborations to evoke addressing key pillars that are key to the health system strengthening. And those are healthcare financing, human resources for health, supply chain, health regulation, quality and standards, that's one committee, quality standards and technology, and public and private partnerships. We have mobilized communities in health evidenced by the East African Healthcare Federation and the Africa Healthcare Federation. We have contributed to policy development, serving as technical advisors to the ministries of health, and served on global initiatives such as the Kenya Coordinating Mechanism with the Global Fund. We have positioned private sector innovators as catalysts for change. Amidst a global pandemic, we have positioned ourselves as complementary in national response efforts, ensuring our citizens are equitably served. To date, the Kenya Healthcare Federation has demonstrated exponential growth, and in my tenure has provided exceptional leadership, a committed and dedicated team who believed in a strengthened health system and have been drivers to significant positive change. It lends to moments like this where I understand the audacity of being bold and the persistence to make a positive difference. As we move forward, I will continue to support the current team and welcome new leadership. I extend my sincere gratitude to the KHF community for the insurmountable support and recognize the continued endeavor to positively position the extraordinary role and contribution of our vibrant private sector. Sincerely yours, Faith Muigai. So let's applaud her in absentia. Good. We also appreciate the role that Dr. Jacqueline Kitulu has played. She was on the board for 2 terms also, and is the immediate past president of the Kenya Medical Association. She also sends her warm regards. So thank you very much, and over to you.
Thank you very much, Dr. Wala, for representing the board members retiring. I think the energy that was in the board, we had very powerful ladies in the board. So I hope more will also come to the new board. Yes. So to our members who have been always supportive of the work that we do, we also really applaud you. So the next session, I'm going to hand over to Ms. Anne Mululu again. I think it is a election. I think we are a bit participating through this process. We normally told it's a process, and it's time we know how the process fared on. So Anne, once more, you're welcome.
Thank you once again. So as you know, the elections were for this year, and so just to confirm that the elections were free and fair, I'm going to give the team the flash disk that I have to announce the election results officially. So the positions falling vacant that were up for election were the chairman's position, the director position, professional association position as well, and the corporate position. Under the chairman's position, the position was unopposed. So we had Dr. Kanyenje Gakombe, under the Professionals Association, that was also unopposed. So we have the position going to Linus Ndegwa. So the other positions that the votes took place, as you are all aware, the voting process started on the 24th of this week. So we had the contestants who were Vinod Guptan, Sophia Huda, Cynthia Kahumbura, and Isaiah Okoth. So voting started on the 24th. On 24th, we had 43 number of votes, 43 members who voted. On the 25th, we had 28 voters. On the 26th, which was the day that the voting was closed, we had 38. We had a total number of 109 voters. The total registered number of voters was 139, so only 30 members didn't vote. So that's a good progress. On the voting, we had two positions that were being voted for. So there are those who only voted for one person and didn't vote for the other. So we had 109 votes. So we had 20 people who didn't vote for the second person. They only voted for one and did vote for the next. So you only had one. So to announce the votes, Vinod Guptan garnered 64 votes. We have Sophia who had 24 votes. Cynthia Kahumbura garnered 53 votes. And Isaiah Okoth garnered 57 votes. Can show them the graphs to see the percentages. So we can see Vinod garnered 32% of the votes. We have Isaiah garnered 29%, Sophia Huda garnered 12%, and Cynthia Kahumbura garnered 26%. So help me in welcoming the new board members of the Kenya Healthcare Federation for the year 2021-2024. To start with, the chairman will be Dr. Gakenye Gakombe. For the Professional Association, Linus Ndegwa. For the corporate position, we have Vinod Guptan and Isaiah Okoth. Let's have the new members join me on stage for the members to know you as well.
Okay.
Thank you very much. I'll give the new chairman the position to give us an address.
Thank you, Madam Secretary. Good afternoon. It's been a long afternoon, and mine is not to make it that much longer. It is first and foremost to thank you as the members for electing us to take KHF to the next level. Secondly, it's to deeply appreciate the work that has been done over those years since KHF was founded. I know it's not been an easy journey. I know how many miles and how many hills that Amit and Okok before him have had to climb, and I deeply appreciate that work. And to all of us who are in this room, I want to say this, that ultimately countries and societies are changed by the interested minority. Together, we are not the entire private sector. I and my colleagues will have quite a bit of work to increase the membership. But together, we make that critical mass that can continue to transform the health sector to be what it can truly be in the healthcare delivery in our country. I'm an amateur student of history, and I would want us to change the narrative of healthcare in Kenya. Because, and I wish Mutahi Kagwe was here, the government actually got into healthcare delivery after the rest of us, and at times tends to act as if it was the original provider and the only provider there should be. If you look at the history of our communities, the first midwives were not working for the Kenya government. There were community health workers delivering babies in their neighborhoods. And where I come from, the medicine man was not an employee of anyone. He was a private sector operator. He didn't charge Kenya shillings. He was paid in livestock. It's only after 1965, when KANU came up with the manifesto of poverty, the three-pillar manifesto of poverty, ignorance, and disease, that the government seriously got into the healthcare delivery space. Before then, it was the Sangomas, or whatever they were called in your community, and the faith-based healthcare providers as the main pillars of healthcare provision. So it is not by accident that the private sector plays such a critical part in our healthcare system today. It is actually a historical fact that we've always been a very, very significant player. And without us, it would actually be impossible to deliver on the promise of dealing with both ignorance, which is handled by education, where we have a very, very significant private sector component, and in prevention and eradication or elimination of diseases, where we play a very, very significant role. We tend to see healthcare from the space I work in, which is the hospital. But it starts with the communities on one side. And it starts with research institutions and manufacturers at the other extreme. Because it's from the communities where diseases are prevented, and where you should do as much prevention as we can. And if there is anything that COVID has taught us, it is that ultimately the best way of dealing with diseases is keeping them at bay, because there are those that will come and we have no capacity and no ability to treat them because they are new. And we fall back to the well-known preventive measures that those who lived in the Middle Ages knew about because they had no treatment for plague or influenza. And at the other extreme, the space some of you play in manufacturing, in getting commodities to our facilities, be they medicines, be they PPEs, that space is actually 100% private. I am not familiar with many government institutions that manufacture medicines or PPEs or that are seriously in research. And even if they are government-owned, they tend to be autonomous bodies such as universities. So we are the cutting edge of our healthcare delivery system. Right from the community and all the way to the factories and supply chains and the enabling technology that we require to ensure that we provide quality, affordable healthcare. As I promised in my manifesto that no one opposed, thank you very much, we will continue to build on what has been built and the very strong foundation that exists. We have to get more money into healthcare, and that means we have to get into the universal health coverage and healthcare financing space. We have to efficiently use the resources that are available, and we are one sector where there is quite a bit of waste. We may debate whether there is more waste in the public sector or the private sector, but we have a fair amount of wastage in our industry, whether it's expired medicines or PPEs or people who don't turn up to work. We have a significant amount of waste that if we eliminate, will enable us to have more resources to give care to the people for whom we work, who are the public and the patients. I intend that we focus a lot on technology, because technology allows us to leverage additional capacities and analyze what we are doing and do things in very, very innovative and efficient ways. And I'm quite happy that we have a technology guru on the board in the name of Isaiah Okoth to constantly remind us that we do not have to reinvent the wheel, and if we are going to reinvent the wheel, it needs to be a very different wheel from the one from the 15th century, because there are far much more innovative ways of doing things better. I intend that we focus quite a bit in making sure that government does give us the space to work, not as a favor, but as a national imperative. Because if we do not have that space, then it will not be possible for Kenya to achieve the Sustainable Development Goals. I intend to constantly remind, and I hope you'll be with me on that one, that there are no such things as private Kenyans. You know, we tend to put the country into silos and talk about people who go to private schools and private hospitals as if they are different from other Kenyans. So the role of the government is to look after all of us. And where we access service, and oftentimes we access it from one side and move to the other interchangeably, one day you're here and tomorrow you're the other way, is a matter of personal choice, and it should not be a basis for trying to put divisions and silos around us. And indeed, when we test Kenyans for COVID, it doesn't matter whether it was done in a private lab or a public one. What is counted is the number of tests we are able to do, the number of ventilators we have, the number of beds, critical care beds we have. The demarcation about whether they are private or public is for internal consumption. And frankly, patients don't care. All they want is to get service when they need it. So I want to, especially as I finish, thank Amit. Amit has already partly told you our journey. We married our university girlfriends. His is here. And clearly there was multiplication, so there is a daughter and another daughter. Mine isn't here. She's a professional. She's working today. He got daughters. I have sons. Maybe you need to have a conversation. Maybe you need to have a conversation. And to assure him that he's handing over to a team, he and our colleagues who are living, because I've worked with them too, that he's handing over to a team that will continue the journey of building an organization that will continue to grow. And when I'm there, sitting somewhere by the beach, he can say, I helped build that organization, because KHF and KEPSA will be much, much larger organizations in the year to come. Finally, I want to appeal to each one and every one of you that the job is for all of us. Mine is to coordinate, occasionally get taken a photograph, every so often get sent by Nyalita to give a speech like the one I'm doing now. But fundamentally, the job is for each and every one of us. And with our combined contributions, with the power in this room, there is nothing that is beyond us. And I want to say that I've already sort of started the job. We had a meeting with the laboratory board not too long ago to try and get the regulator and the regulated to work better in an enabling way, to make sure that the way we are managing our laboratory resources is much better coordinated and is done in the spirit of partnership, rather than what my brother described about people coming with mallets and padlocks and media to close institutions, because that is an era we never wish to see again. So asanteni sana. I will do my best to serve you and to serve the sector and to serve patients. And I am sure with your support, we shall succeed together. Asanteni. I'm already getting instructions.
I like that you can see it from far. So congratulations, Daktari. Congratulations to the new board. We are looking forward to supporting you. It's been amazing energy from the team that was there before you guys. I'm sure that will continue, and we're wishing you all the best. Yes, an assignment before you go. We want to appreciate all the board members that served in the previous term. And Lea, where is your team? Dr. Gakombe, for the board, I would like you to have the honor of just giving them what we have prepared for them. Some of them are here, most of them are not here. I think we should start with the chairman. So, yes. Dr. Amit?
Yes.
I don't know where is a good place to take a photo.
Now, Mulet. Yes.
Please.
Good one.
This for Dr. Amit. So what we are giving you is just a token of appreciation.
Thank you.
Something you'll see in your office, wherever you prefer to say that you served. But also the tools of the Kenya Healthcare Federation, the profile, and one or two other things. So thank you very much.
Thank you so much, management and board.
Please come and join us.
Seb, come. Please. Alisa, come.
Yeah.
Yes.
Come.
And,
where I come from.
Now you know, yeah.
Any man who is alone is not man enough.
You know.
I agree with that comment.
Come on,
Yes,
this side.
yes.
Alisa, move on that side.
Yeah.
Yeah.
You only
Is this
complete
blocking you? Or can they move
if
down
you are
there?
with.
You can move down there for
You-
the KHF and
okay.
KEPSA.
Okay.
Yeah,
All right,
I think
yes,
that's better.
even better. Okay, here we are.
So, okay, great. So thank you very much for the hard work, and we will definitely be consulting. Next on the board is the Vice Chair, Dr. Elizabeth Walla. She is on to her second term, so thank you very much, Walla. All your energy is much appreciated. Walla also sits at the board of Kenya Private Sector Alliance. We will also be hearing a short speech from the KEPSA Deputy CEO in a short while. So, asanteni sana. Next is Dr. Walter Obita, who is also Director. We're giving everybody that served, all the directors that served in the previous term. This is a new term, so that one is delete and archive. Then Joyce Wanderi. Thank you very much, Joyce, for the selfless work. We appreciate that very much, and the inspiration and the support from your institution as well. And by the way, Joyce helped us draft or rather polish up the policies of the Federation. So we are good to go in terms of governance because of Joyce and her institution. So thank you very much, Joyce, for that. Then we have the youngest kid on the block who has been very active today, Mr. Anthony Jacodo. Anthony Jacodo came in after the current CEO stepped down, so he was a replacement for Dr. Kamunyo. So karibu sana, and we're looking forward to another term with you. Those who are not here, some of them are online, so we will appreciate them. There's Dr. Jacqueline Kitulu, who was representing professional associations and the Kenya Medical Association. Sorry. Oh, okay. Yeah, you will receive for Jackie Kitulu, please. Dr. Kigondu. Is synonymous with Kenya Medical Association, eh? Yeah, so please pass our regards to Dr. Kitulu, very active, very energetic, very insightful, and full of wisdom. She was also leading the Human Resources Committee of Kenya Healthcare Federation. Then we have Faith. Faith is not been able to join us today. We have Dr. Francis Karanja, also who stepped in when I stepped out and became organization. So just an appreciation. And then we have Dr. Francis Karanja from Kenya Kapi. So if we have anyone from Kapi, John, please come and receive it for him. You're the only one I can see. Vinod has stepped out. Please come and receive for Dr. Francis Karanja. And then the next session, I will hand it over to Dr. Walla to appreciate our sponsors, our guests, and our committee chairs. So I hope we still have committee chairs here. So asanteni sana, and over to you. Sorry. That's for Kapi, yeah? For Dr. Francis Karanja. So the shield as well. No. Okay, thank you, John. John works for Bayer. Bayer is a member of Kapi. Bayer is also a member of KHF. I can retire you now. Thank you, Chair. A lot of work ahead for us. We're looking forward. Over to you, Dr. Walla, and then we can get it back to Jacodo to close it. But before we close it, please, we want to acknowledge the presence of KEPSA Deputy CEO, and we can give her a chance to speak as well. Yeah.
Thank you very much, Anna. So we want to appreciate the people who've facilitated this meeting in terms of sponsorship. So we have Hiroki, if the representative can come forward. Thank Thank you very much. I'd request Martha Cheruto, who's the Deputy CEO for Kenya Private Sector Alliance, to hand over. Please stand over there. Yeah. Yes. So thank you so much, Hiroki, for sponsoring our annual general meeting. Yes, Martha, you're supposed to be giving our sponsor. So thank you. Next up is AMREF. AMREF was a sponsor for this event. If the representative can come forward, Peter is coming forward. Asante Sana, AMREF. Followed by ARC, Africa Resource Center, Anthony. And last but not least, Equity Bank. That's my namesake, Elizabeth, if she's still around. Thank you very much, sponsors. We appreciate that you believe in us, and we are partners along this journey. Thank you, Equity Bank. As we wind up the sponsors session, I want to appreciate the committee chairs. I want to start with Dr. Njoki Fernandez, who leads the healthcare financing. I think she's streaming in online, but a member of her committee can come and receive on her behalf. Huh? Okay, Dr. Walter Obita. Yes, Martha, please. Yes. So Dr. Walter Obita is a board member representing healthcare financing, receiving this on behalf of Dr. Njoki. We have Dr. Turuti. Dr. Turuti was heading the ICT, is heading the ICT committee. Thank you very much. Will be followed by Ken Auma, Mr. Ken Auma, if you're here. If Ken is not here, a member of his committee, Ken was heading the Human Resources for Health Committee. Is there any member of the HRH committee? Yes, please. Thank you very much. Receive our appreciation on behalf of Ken. We have Dr. Ann Musuva, who was heading our partnership PPP committee. Is Anne around? Any member of the committee to receive on her behalf? Thank you. We have Millicent Oulo, who was heading our quality regulations and standards. If Millicent is not here, kindly anyone from the committee to receive on her behalf from the quality and standards. Okay, yes, Asante. And we have Vinod Guptan. Has Vinod left after being voted? Okay, so Vinod was heading our supply chain committee. So anyone from the supply chain committee who can receive on his behalf? Supply chain. Okay, we can have anyone else receiving? Dr. Kigondo, you can receive we're using distance. So Simon Kigondo will receive on behalf of Vinod. Then we have our guests who graciously came for our event. I want to appreciate the... So Martha, you can't give yourself. Okay, so let me see whom to appoint to give. Yes, Anna. Thank you. So Martha Cheruto, thank you for gracing. She's the Deputy CEO of Kenya Private Sector Alliance. Dr. Jacinta from the Pharmacy and Poisons Board, Karibu Sana. Do we have Mr. Elkanah from the Ministry of Health? He was here? Okay. I'll request, and do we have Maureen from the Ministry of Health? Okay, Jacinta, if you don't mind receiving for your two counterparts from MOH. Thank you. Mr. Elkanah and Maureen, thank you very much for coming for our event. And the next lot of people that we want to appreciate is everyone who put their foot forward in throwing their hats into the ring. So all our contestants for the different positions. We have Mr. Vinod, we have Mr. Isaiah, we have Sophie, we have Cynthia, we have Gakombe, and in absentia, we have Mr. Linus Ndegwa. So, Dr. Gakombe, please come forward as a contestant. Mr. Isaiah Okoth. Dr. Amit, if you don't mind handing over this, the gifts for the courage and the commitment to volunteer themselves. Yes, please. Yeah, the photo session is down there. Yes, thank you. So we encourage people to step up into leadership positions.
This is selfless service, so I think let's give it a round.
Asante sana. Mr. Isaiah Okoth. Thank you. Is Sophie around? Okay. She'll be represented. Cynthia Kaumbura. Thank you.
Cynthia, you are still a winner?
Yes.
Cynthia and Sophie are still winners?
Yes, we shall incorporate them.
This close, I know. Big round of applause for Cynthia.
Thank you. Thank you very much, Cynthia.
You remain connected.
Yes, Asante. And on behalf of Sophie, Asante Sana. We'll have Dr. Simon Kigondru from the Kenya Medical Association receiving on behalf of Dr. Linus Ndegwa. Unfortunately, Dr. Linus, okay, Simon will speak on that.
Yeah. So we have just come from thanks. I've just come from the funeral service of the wife to Dr. Linus. It was today at the Holy Trinity, Kileleshwa. And on behalf of Dr. Linus, I'll probably welcome you to the funeral this Saturday in Othaya. The body leaves Lee funeral at about 7 o'clock, and he'll be buried. And all of you need to really support Linus. He has 2 young boys who require taking care of. And I think our support will be useful. On our behalf, he is the president of Kenya Dental Association and is the representative of the medical associations, of which Dr. Jacqueline Kitulu has just left. Let's keep him in our prayers.
Sincere condolences.
Thank you very much, Simon, and our condolences. So over to the MC of the event to wrap. No, we are introducing Martha Cheruta. Okay, he'll do that. Karibu sana.
Okay, we're just winding up, and out of maybe respect, I would like us to maybe observe a moment of silence for our departed colleague, the wife to Dr. Linus Ndegwa. I think she was also part of the medical fraternity. Thank you very much. Okay, so we'd like to maybe wind up, and I would like to call upon the Deputy CEO of KEPSA just to have a few remarks, and then we'll be able to wind up. Karibu sana, Cheruto.
Good evening. Hey, it's an AGM. Good evening. Thank you. My name is Martha Cheruto, you've been told. I am the Deputy CEO of the Kenya Private Sector Alliance. And indeed, I'm happy to be here to represent the entire board of KEPSA, our CEO, the leadership that we appointed today, and just to come in and join in at the sector board, because this is our health sector board. This is the KHF, which is the KEPSA Healthcare Sector Board, and we are really proud of you. So before I continue, I think as we appreciate the outgoing and the incoming team, we will do an atama. Atama is 1. So to appreciate you and tell you congratulations, we'll do 3 atamas. Are we ready? So let's do it. Just let's do this first. So we'll do 3 atamas. We go atama, atama, atama. Thank you. That's purely to say asante sana. The work done has been tremendous. And as I continue, I want to read something. Amit, I know we were having our AGM today at Serena in the morning, and that is why we were not able to make it on time. We're also doing a transition like you. We have a new chair. Our new chair is Ms. Flora Mutahi, and we have our vice chair, that is Jaswinda Bedi. So there has been transition. Even within the sector boards, we have transitions. Fortunately, KHF being our healthcare sector board, we still have the vice chair, that is Dr. Wala, who still serves in our board. And we also have the CEO, that is Dr. Nyalita, still serving in the governing council of KEPSA. But that doesn't mean that the chair is out. So Dr. Gakombe, I know you have history with KEPSA. We truly welcome you to the KEPSA family. So Amit, we were not able to read this in the morning, but allow us to read to you what KEPSA feels, and so to just appreciate that whatever you did to sacrifice, especially knowing that you are coming from COVID, you've done really well. But as they say, crisis, when you read the Chinese, they say it has 2 characters. One means danger, and the other one means opportunity. But what happened during last year is that we all took the crisis as an opportunity to scale to better heights. And through the Healthcare Federation, Dr. Amici stood up very well and showed us that this is an opportunity that we can all take advantage of and make it better. Right now, KEPSA is known and KHF is known. So we truly say, Asante Sana Amit, Wala, thank you very much. Anastasia, thank you very much. And to all of you, because this would not have been possible if you are not providing that support. So I will read, and this is what we said to Dr. Amit Thakur. Sometimes it's interesting. So you can listen. And we said, Dr. Amit Thakur's 6-year term at the helm of the Kenya Healthcare Federation, which is the KEPSA's health sector board, has been more than successful. Some of the notable achievements, which we thought would highlight this time, although there are many, actually 5 of them. 1 is that you have led the private sector to successfully engage the government towards effective policy and advocacy initiatives. The Health Sector Board has institutionalized the Ministerial Stakeholder Forum, that is the MSF model, with the Ministry of Health as a critical pathway for health sector policy advocacy initiatives. This has contributed to many advocacy wins, including the Universal Health Coverage, UHC, and reforms at the NHIF and KEMSA. We truly appreciate that. We can give him a clap. Then I'll read the other 4, and then we'll do the final clap. The second one that we also appreciate you is that through your efforts at KHF, the government removed VAT on raw materials for pharmaceuticals manufacturing in Kenya, and this dramatically dropped the cost of local production of medicines. We saw harmonization of regulatory boards for focused and enabling compliance, thus improving access to quality healthcare in the country. The third thing that we want to recognize is that with your team at KHF, you have been a champion of the COVID-19 response in Kenya. You have mobilized resources for COVID-19 response, ensuring that all healthcare facilities have enough PPEs, as well as all the requirements for COVID-19 testing, treatment, and vaccine rollouts. And we truly say that we usually have the Tuesday meetings, and we're always happy that healthcare sector always comes in and just gives us what is going on. We've seen donations to the ministry, we've seen it to the counties, we've seen what you've done, and right now, the model that is coming in terms of private sector supporting government on vaccination is something we truly appreciate. And that one comes in very well where we say that through your leadership, the government has approved the framework developed to clarify the role of private sector accelerating COVAX. And finally, just that we want to highlight is that you championed the Wheels of Life initiative, which was launched last year in April to provide transport for pregnancy-related emergencies during curfew hours. This initiative has now successfully been supported, and it has supported over 9,000 women in Nairobi, Uasin Gishu, Kiambu, Machakos, Nyeri, and Nakuru counties. And at the same time, we give also credit through this initiative to Dr. Karaoke, because she also came up with it, and within the call center. So those are the things that we wanted to really highlight and still tell you that, Amit, you always did your work with a smile, and that we always know. It would be tough, but it would be really hard for you to see Amit getting angry or low. All the time he was smiling, but at the end we always got results. You really pushed. Your sacrifices, success, your efforts, your sweat has brought this, that you have all these people listening in and just saying, well done. And by that gift that you're given from KEPSA, the gift that you've been given at KHF is truly a symbol of the leadership you have created. And it is well also at the same time for the new team that is coming in. We are ready to truly support you. We are there as KEPSA. You have the leadership all the way from the new chair and the management providing all the support that you require. We will work together. And so we are told that the future is completely open, and we are writing it moment to moment. From now, Dr. Gakombe and your team, this is the future. You will start writing it from now, right? Yes, so we expect the best. The past, the shoes of Dr. Amit are very huge. As I said also to our chair, he will go with his, but we are waiting to see the path and the type of shoes that he will put on. So with that, we really say, asante sana, God bless you, continue keeping safe, and let us continue engaging. Thank you very much.
Thank you, Martha. Also very energetic. We were with her in a couple of counties, then I gave up and didn't go to Mombasa. She went there and it was amazing. So KEPSA is always giving us a lot of support. Thank you guys for coming. I'm not dismissing you now. It's celebration time now. We have a cake, Amit and Gakombe. Please, with your teams and also the guests. Leah is bringing the cake here. We really need to have this. If you look at this, this miracle photo, we need to have it also for this. So if you may please come, the board, the outgoing guests, MOH, PPB, Dr. Jacinta. The sponsors, please come. If it were not for you, we would not be here. Thank you very much for that. Please, as after we cut the cake, then tea will be served. So tafadhali, Leah. Yes, passing the baton. So we have KEPSA, we have the incoming chair, we have a new chair, we have outgoing chair, we have the board, we have the sponsors. Yeah. We can flank them, those of you who are able to. And okay. So are we ready? Going one, going two, and gone. So old board gone, new board on board. Thank you. So asanteni sana. And congratulations to the new team. Thank you to the outgoing board. All right. So I think the cake will also be available. Yeah?
Anastasia, you should come to the photo. Yeah. Anna, stand here. One more photo with Anna. This is Sergio. Anna, hold here. So, hold. Can we ask the members to come?
So I believe you can leave at your leisure, but please remember tea is served. There is cake, there are snacks. You can continue working, mingling. Don't leave immediately. It's an opportunity for you also to meet your networks. So asanteni sana, and we wish you all the very best. Thank you.
So Kenya Healthcare Federation came about when 7 organizations got together to create a single voice for the private health sector in Kenya. These 7 organizations came about because there was a bill in Parliament known as the National Social Health Insurance Fund Bill, trying to create universal health coverage for all Kenyans. It proposed at that time to charge 6% employee tax and 6% employer tax. We realized that the 12% increase in payroll tax was going to make the cost of business much higher, the cost of employment higher, and we needed to give a policy position statement. We realized we lacked the vehicle where we can speak with one voice. Kenya Healthcare Federation was then born. We are officially the Health Sector Board of KEPSA and work very closely with Kenya Private Sector Alliance to ensure we create an enabling environment.
So in terms of Kenya Healthcare Federation membership, the membership is in 3 groups. This is either a trade or what we call institutional associations. These are institutions like the Federation of Local Manufacturers, the Kenya Association of Pharmaceutical Industry, the Association of Medical Insurance Providers of Kenya. Also, the other group of membership is health institutions. Under health institutions, we have NGOs, commercial and social enterprises, and also thirdly, we have professional associations. So what are the benefits of being a member of Kenya Healthcare Federation? So you benefit by, in terms of advocacy, because Kenya Healthcare Federation is a voice of private health sector in Kenya. So in that way, we engage the government a lot. Our mandate is about public-private partnerships, engaging the national government, engaging the county government, engaging the development partners and other partners.
Our focus with the members that we have who are in the commercial sector, it's very clear that we can make an impact in 6 different areas. And each one of these areas has a specific committee dedicated in creating a policy position paper and enhancing its role in the health system.
The importance of supply chain is that it transcends from the time the product is manufactured all the way until it gets to the patient. So be it a medical device or a pharmaceutical product. And our role as KHF is to harmonize this system to make sure it works flawlessly and the products are able to reach the patient or the customer at the right quality level, and so that they are efficacious and provide the benefit that was intended.
So the ICT and Mobile Health Committee of KHF is an important one because, as you know, information is a pillar in a health system and correct information. And so the ICT and Mobile Health Committee tends to attract the members who rely heavily on mobile health and ICT to carry out their business. The key focus has been, at least the last few years, to bring up the policies in the country that govern ICT and mobile health, because we realize we have a ways to go to get a good regulatory and policy framework for us to do some of the things that we want to do as individual companies that are members of the committee. So I think the committee has been a great avenue for advocacy for private sector actors to have their views reflected in government policies.
So our role as the Healthcare Financing Committee is to advocate for policy, regulation, legislation and practice that can enable the private sector to play its role when it comes to mobilizing resources, pooling them and allocating them for procurement of healthcare services. So we bring together players in the private sector who look at health insurance, bring together service delivery providers, procurers of medical products and technologies to discuss on the best healthcare financing modalities to increase access to affordable healthcare to the people. So currently, as a committee, our main focus is on the government's agenda on universal health coverage. And as a committee, we want to champion equitable access to healthcare and more so affordable healthcare to the population. So as a committee, our success is seen in the strong partnerships that we have with the government, and as we advocate for health financing reforms and a progressively responsive health financing mechanism in the country.
Fundamentally, we are trying to encompass all pillars together and actually bring a system perspective around healthcare design and healthcare systems development and strengthening. When we talk about quality, we're talking about human resource for health. We're talking about health regulation and policies that govern health systems. We're talking about technology as a key enabler in driving. We're talking about healthcare financing, not only on the supply but also on the demand side. We're talking about public-private partnerships, and one key role KHF has played in this arena is actually partnering with the Ministry of Health in actually garnering their Kenya Quality for Health framework in terms of actually holistically assessing facilities and preparedness in the day of COVID-19 while looking at system preparedness. And so we have been key and instrumental in policy development and rollout, as well as technical support for the Ministry of Health.
So within the Kenya Healthcare Federation, we do have a committee called Human Resources for Health. This is chaired by one of the team members, and in this committee it consists of various issues that we're looking at. One is looking at the training needs in terms of do we have enough health workers and are they trained for market? And the second one is in terms of their development needs. Now we've picked three areas three of the human resources for health sectors. One is emergency medical technicians, the other one is community health workers, and the last one is on medical record technicians. So the reason why we've chosen these three is because they are very critical part of the human resources for health, but currently are not under a regulator of sorts, and also have schemes of service. So far we've been able to push quite a number of legislation through. One is in terms of the Community Health Services Bill, and the other one is for the Emergency Medical Technicians Bill. So overall, we do look at how can we improve quality of training. So we have our members who offer this training, but we also have our members who have facilities where the human resources can work in. So that is, in a nutshell, what we do at Human Resources for Health.
One of the things that's been a big challenge, even as we started as board members for the last couple of years, is really trying to see how can the Ministry of Health really see private sector as part of the health mixed health system for the government, that we are contributing something and that we are seen as part of the system and not as just a private sector that's really just thinking about the profits. And we really worked hard to try and make sure we can bridge that gap. There have been many ways we've been trying to do that, really having dialogue with the government. There are many forums that we've been able to participate in, like the Ministerial Stakeholder Forums, Presidential Roundtables, all geared towards really having a dialogue with the government to try and really establish what our role is, how we can work together and make sure that we can make sure that Kenyans are getting the best health care. Right now, if you look around, you'll see actually private sector does play a big role right now on the various tables. We invited in all the tables. We are actually participating in decision making, which was not the case in the past.
So really, as KHF, then what we have done is to be part of the whole health network. Rather than stand aside, we came together with government to run together in terms of the preparation. And really, most important was ensuring that our healthcare workers were, their capacity was built for the current pandemic.
This is a very unique advocacy platform that's bearing fruit for influencing policy and changing policy. And the same model is being used in many parts of East Africa and other parts of Africa. So we're very proud of how this originated in Kenya, and we're very delighted that 27 African countries have taken on this kind of a model to improve public-private dialogue.